Yes, sir. Opo.
Pwede
Good
na?
morning, Comsec.
Okay.
Morning po.
Morning, everybody. The meeting is now called to order. Do I hear a motion to?
Mr. Chair, Mr. Chair,
Yes, Congressman Mark.
I move that we dispense with the calling of the roll.
Do you hear a second?
Second.
There's a motion to dispense with the calling of the roll and duly seconded. Motion is carried. Do I hear a motion to dispense with the reading of the minutes of the previous meeting?
Motion to dispense with the reading of the minutes of last meeting.
Any second?
Second, and approve the same, Mr. Chair.
There's a motion to dispense with the reading of the minutes of the previous meeting and duly seconded. Hearing no objection, the motion is approved. Comsec, may we have invocation? The invocation.
Sir Honors, please, may I ask everyone to bow down their heads. Loving and gracious God, we thank you today for your blessings. We humbly ask that you bless us in all abundantly as we continue to seek your wisdom, guidance, courage, and strength. Be with us in our deliberation and help us to be wise in the decisions that we make. For the good of all those who have placed their trust and confidence in the leadership of our principals, give us insight to lead with integrity, that our decisions may reflect what is right and good. Keep us from short-sightedness and pettiness. Dear Lord, grant us the humility to always seek your will in all that we do and say. Amen.
Amen.
Thank you, Comsec. At this point, we would like to acknowledge the presence of the following members of the Committee on Health. Vice Chair, Congresswoman Marilu Arroyo.
Good morning, Kong John, Kong Arroyo, Kong Go.
Good
Good
morning.
morning.
Ibkas.
Kamusta po kayo?
Congressman Go, dalawang meeting natin ngayon nakasabay, yung sa Wiz Admins at saka dito sa Health.
Yeah, kaya dalawa yung screen ko rito.
Okay, we continue with the acknowledgement of those present in this meeting. We acknowledge the presence of Congressman Mark Go, Congressman Adriano Ebcas, Congressman Hila Costa, Congressman Ompong Ordanes, Vice Chair Maria Lourdes Arroyo. Congressman, did I mention Congressman Adrian Abcas? Anyone?
Yes, thank you, Kong. Good morning.
Did I
Good
miss
morning, my dear colleagues?
member?
This is Rufus Rodriguez, present.
Thank you very much, Deputy Speaker Rufus Rodriguez.
Present, Mr. Chair.
Chairman of the Trade and Industry, Kong Ray Tiangco.
We'd like to acknowledge the presence of Congressman John Ray Chanco.
Good morning,
Thank
sir.
you very much. At this point, I will read a brief opening. Good morning, colleagues, resource person, valued stakeholders, and friends. I am extremely pleased to welcome you all to this meeting today. A quick rundown in today's agenda for various local measures we intend to put. Our seal of approval will give us a definitive stance on our resolute response to rise up to the challenge of coming up with important legislative initiatives that will significantly impact on the lives of our poor and bridge their access to the benefits of an inclusive healthcare system, which we will all pin our collective hopes to substantially accomplish, even as the country and the whole world continuously and painfully reel from the devastating havoc of COVID-19 pandemic and putting our public health system in the brink of near collapse. Indeed, the scenario has never been grim of coping to survive the harsh onslaught and impact of COVID-19 on the country's unimaginable economic downturn. deep poverty-stricken metropolis and rural communities, unmitigated job losses, eroding businesses, and thinning livelihood opportunities, which all together push the country to massive poverty and almost state of recession. On a positive, cheery note, however, let us remain optimistic that we can still attain our comprehensive resiliency targets through the convergence of government efforts in precise points of the archipelago where public social services and healthcare will make a dent to alleviate or positively address deeping poverty. Hence, this strategic aim implies the need for relevant programs that synchronize with the government's fight against COVID-19 and put the country in shape. Towards these efforts, we need to create a supportive mechanism to beef up the capacities of the LGUs to take pivotal role in much of the national government's program implementation of the delivery of critical services to successfully mitigate the impact and cost of COVID-19 fight on the nation's poor. All these bills for consideration are strategically envisioned to put the country, specifically our rural areas, at the forefront of health resiliency competitive advantage, both at the country and global levels. We have invited the presence of relevant agencies and stakeholders to share their important inputs on the proposed measures' intent and feasibility. In this connection, we trust you will favor the committee with your valuable position on the pertinent provisions of the bills relevant to your respective agency. On this note, the committee is ready to hear the presentations and comments of our invited resource person after their author's sponsorship. Thank you very much.
Mr. Chair,
Yes, Congressman Mark.
yeah, may I request that our COMSEC will introduce our resource persons? I can see a lot of friends from PGH, from DOH CAR, and our medical director from Baguio General Hospital, and the other guests present, Mr. Chair.
Yes, Mr. Chair. Comsec, can you please introduce our resource speakers for today's meeting?
Yes, Your Honors. From the DOH, we have Mr. Roderick Napulan, Division Chief. We have Dr. Annabel Yumang from the CHD Region 11. We have Director Ruby Constantino, CHD CAR. We have Armulsaiti Karay, CHD Zamboanga Peninsula. From the DBM, we have Miss Mary Grace Darunday, Miss Gian Gaudiel, Miss Eliza Jane Mernelo, Miss Bernardita Chua, John Addis Makaspak, and Charmaine Velasco. From the University of the Philippines, Manila, we have Dr. Charlotte Chong, Dean of the College of Medicine. We have the Chief of Hospital of the UPPGH, Dr. Gerardo Legaspi. We have Chief of Hospital of the Davao Regional Hospital, Dr. Brian O'Dalib. And from the Baguio General Hospital, we have Dr. Ricardo B. Nunez. That's all, Your Honor.
Thank you, Comsec. We now proceed with the first list on the agenda, the upgrading of the Philippine General Hospital. May we now call Deputy Speaker Rufus Rodriguez for his sponsorship speech on House Bill number 1844. Deputy
Thank
Speaker
you very much,
Rufus.
Mr. Chairman. Good morning to our dear colleagues and to our valued resource persons. Mr. Chairman, House Bill 1844 seeks to construct and establish what we call the Balay Bantayan. What is this? You know, I have many experiences already, Mr. Chairman, of bringing relatives and friends to the PGH and being able to bring them to the emergency room. And Mr. Chairman, I saw a lot of people outside the emergency room. Who are these? These are families and friends who have to bring in their patient for emergency care, and they are waiting, Mr. Chairman, for their loved ones to be treated and then probably to be brought home or to be assigned for admission. And they are just there outside, and there is they are open to the elements. And so, Mr. Chairman, my bill seeks to construct and establish this bantay antayan so that the bantays will be, having a place where they can stay and wait for a while after the emergency. Either they will accompany their loved ones back home because it's finished, or they are those under emergency are referred to be admitted, and they will now accompany them to their rooms. And with that, Mr. Chairman, I therefore file this bill. Well, this has been filed for the past 3 Congresses. And, it is only this time that it has been calendared. And so after waiting for 9 years, I am very happy that we are going to discuss this. And we will have our, Vice Chair Marilu is smiling because she's going to therefore support this very well. And so I have this bill authorizing the construction of the Bantay Antayan and giving a budget of 100 million, probably 9 years because of inflation. This should be 200 million, Mr. Chairman. And so with that, I seek the kind support of our colleagues and also our valued resource persons. Thank you for the opportunity, Chairman June. Thank you very much.
Thank you, Deputy Speaker. I am fully behind you, Deputy Speaker. For the information of everybody, I spent almost 10 to 15 years in UPPGH, so I can fully understand the plight of yung mga bantay. So not only in the emergency room but in all other wards of the Philippine General Hospital. Ang Philippine General Hospital, ang sabi nga nila, is the hospital of last resort of the Philippines. Doon na pupunta lahat ang mga kababayan natin from Batanes to Tawi-Tawi. At ang hirap na mag-antay ng ilan araw or kuminsan linggo to weeks to months sa PGH na wala naman pansamantala munang antayan. So I fully agree with Deputy Speaker Rufus Rodriguez.
Thank you, Chair June. Thank you.
May we now hear a comment from representative from Philippine General Hospital. Maybe we can start with Medical Director Gapli Gaspi.
Thank you, Mr. Chairman. I'm really honored to be here in front of all our friends who support PGH, and I'm just really thankful that all of these are coming into place now, that we are pushing really for a big infrastructure development in the Philippine General Hospital, maybe much different from when you were there 15 years ago, more than 30 years ago, Chairman. So Congressman Rodriguez has presented the problems of our patients who wait in the emergency room. I just would like to add, we have a newly built emergency room, which is really Class A in appearance, to give more comfort to our patients, and it's designed to hold 120 patients. So you can imagine the number of watchers that these patients will have. So it's just really timely that the proposal for a Bantay Antayan is up in the session. And just to maybe just to add a little more credence to it, we are actually building a 15-story facility beside the emergency room where we really intended to put a Bantay Antayan. So the Bantay Antayan has a place in a 3,000 square meter area, and this is all part of our 20-year master plan. If I can maybe just share share the screen. This is Chair, this is the area of the emergency room. So in the 20-year master plan of PGH, the first building that will be built this year, starting this year, which is funded already, will be this 15-story multi-specialty building, which is just across the emergency room. So we envision the watchers to be waiting here for any instructions about their relatives or information. So The plans have been drawn up for that, and as I said, it's really timely that this bill is being proposed to support PGH. So I'd like to thank the good sponsor for the bill creating the Bantay-Antayan. So
Director Gap Ligaspi, in case there will be the House Bill number 1844 will be implemented, where will you intend to build the Bantay-Antayan? Will you build it in a different site, or will just add additional floor to the
This is-
existing planned 15-story building?
yes, as I said, it was envisioned to be part of a master plan that has been done by professional hospital architects for PGH that was bid out as a contract. And the Bantay-Antayan is actually placed in this building so that it will offer other amenities to patients' relatives also. So it will have a concessionaires area. It will have a temporary shelter for them. So it will be built in this area because in the master plan, the area in front of the emergency room will be kept open for in case of mass casualty. So we are taking out any structure in front of the emergency room in the master plan.
So
it will be-
isasama na dun sa 15-story building yung
Yes, yes, po.
Bantay-Antayan,
Yes po.
Director Gap. Okay.
May plano na rin po yan, nakadrawing na yung mga plano sa tamang-tama po eh. Oh.
So, Mr. Chair, may I ask DS
Yes,
Group?
Congressman Mark, you're recognized.
Yeah, so in other words, the budget, once this bill is approved, we will just, build this within the existing plan of UPPGH. It will not be...
That is my understanding, Congressman Mark.
Yeah. So, Mr. Chair, in other words, do we still need the bill to put up this building, considering that UPPGH has already a budget for the construction of this facility, including the other facilities within PGH?
I'm sure the PGH will welcome additional funding for additional space for the Bantays in PGH. Director Ligaspi?
Yes, sir.
Or do we simply want to ask the government to fund additionally this construction ongoing by PGH?
Deputy Speaker Rufus,
I would like to seek the wisdom
Sorry,
of...
sir, I was disconnected in my other computer. So we, as I said, we have started fundraising for this building, and it is a welcome addition. It is really a serendipitous addition to our effort to improve the plight of our patients and their watchers. So I think we still need the 100 million will still really go a long way to ensuring the construction of this floor for our patients, watchers.
thank you, Director Gap. Deputy Speaker Rufus, you're recognized.
Yes, Mr. Chairman, I like the word serendipity. So I'd like to first ask Director Ligaspi, don't you have any side effects on the Sinovac? If I proceed with that? Because you are the man of the hour, because you were the first one. How is it? It's okay, and all your staff, all the doctors and nurses in PGH?
Yes, they're okay. We observed there is more side effects actually with AstraZeneca. So there were more people who complained of fever and chills, and some of them not being able to go to work the next day with AstraZeneca. With Sinovac, there were 2 that had to be treated for severe allergy, but these are doctors who already had severe allergy to begin with. So, but in general, of the number of people, number of vaccinees for Sinovac and Astra, we had more reports of minor side effects with AstraZeneca. Me personally, it was another ordinary day for me after the vaccination. So wala po nangyari naman ho.
Thank you. Thank God. No? Thank you.
DS Rupos, we have also our medical director of BGH, the first in CAR, that had the Sinovac inoculation.
Yes. Can
This
you hear
man,
him?
Dr. Ruñez, Dr. June Ruñez, you might want to testify to collaborate the statement of Dr. Legaspi.
Yes. Good morning, your Mr. Chairman, Your Honors. Yes, I also had was inoculated with Sinovac, and then I have very mild symptoms. No, so I was able to get back to work the following day. So the same as UPPGH, we had more reactions with AstraZeneca than that of Sinovac here in Baguio General Hospital.
If I may add, I also had my Sinovac vaccination last week as a medical frontliner, and it was just an ordinary day for me. I never had any symptom, mild or otherwise.
Thank you. Now,
Anyway,
my question now, Mr. Chairman.
yes,
So again,
Deputy
to
Speaker.
Legaspi, we really appreciate the information given by Directors Legaspi and Ruñez. Or I would like to ask the 16-story, how do you call that?
Multi-specialty building po.
Multi-specialty building. Now, it is envisioned to house, before my bill, it was envisioned for what purpose under the master plan?
So this will house the Brain and Spine Center. This will also house the highly advanced central laboratory of PGH. It will house the biggest burn unit in the country. It will house the multidisciplinary services pertaining to the brain and spinal cord. So it will also have the 2 floors of parking lot, and of course the as I said, the watchers area, which we hope will be a big push, will be a big comfort to our patients in the emergency room.
So I would therefore, so the Bantay-Antayan would certainly be in the first and second floors. They have to be near the ground to be able to go back and be able to get their loved ones for after their treatment in the emergency room. Is that correct? Is that the plan? We have the first floor or second floors?
Yes, po. So in the master plan, the buildings will be interconnected by footbridges in the first floor and the second floor as well. So it's connected physically.
And the parking is underground, basement?
Sorry, because PGH is a reclaimed area, we cannot have an underground parking in our area because the soil, the water level is already present at 1 meter deep digging. Yeah.
So if we have the first floor for the Bantays, the second, third floor will be parking?
We will have, yes, we will have to change the order of the floors. Maybe we'll have the second floor for the Bantay now.
Okay.
Now that this is more concrete, because when we were planning it, we didn't have money for it yet, but this is really good news for us. So it's more concrete that we can have it there.
Because I thought when you said that we have a multi-specialty, because in many hospitals, private ones, there is a nearby structure for those who can check in. In other words, rooms for the Bantays. We are now talking of not only those who are, going to the emergency room and wait there for 6 hours or 1 day, but patients coming because they go to PGH, even Cagayan de Oro. Some of them I have been able to recommend treatment there, no? Because first they believe that PGH is more complete, although we are now improving very much our Northern Mindanao Medical Center, and some Cagayanons are staying in Metro Manila. So when they, for example, they come from Laguna, they go there. Some hospitals have their own hostels. Have you not envisioned that, being the primary hospital, that there is a building not only for Bantay-Antayan that you're just going to wait for some hours, but who would have to stay because the treatment, and they come from the province, the treatment would require 1 week or 2 weeks. such that they would need to be, to have a chance to be near the room where their loved ones are assigned, and to be able to take care of them and visit them without the hassle of the famous Metro Manila traffic. So is that an option that you have, or another building, or something like that for our patients' families?
Okay. Ako, tama-tama rin po yung tanong ninyo, Congressman Rodriguez, because last year, the Office of the President sent me a note that they are supporting a halfway house for PGH patients and their relatives. So this is a structure near PGH. We have found one. So with the cooperation of Mayor Isko, he gave us 400 square meters near Santa Isabel College, which is around 800 meters from PGH. The plans are being drawn up now. DPWH is going to build it for us. It's going to be a 4-story halfway house. No? Tama-tama nga po, nagdudugtong-dugtong itong mga plano eh. So it's actually the Office of the President who's Senator Bongo called up to give the support for this building. So, and then we're building another halfway house within PGH for the overnight stays. It's an old dorm. It's a 1910 dorm that is now nearing completion, which will house around 30 watchers or patients overnight or 2 nights. The short stay, doon po sila. So we are aware of this problem of our patients. In the old nurses, we will put them there in one part of the old nurses home.
Wow, Mr. Chairman, all I can say is to say, wow, we have a very proactive director here, because these are really the felt needs of our people. And I'm happy to learn about that. First, there will be a halfway house, 4 stories. And so Cagayanons who come from Cagayan de Oro can stay there for some time. And we have also an overnight stay in the old nurses' home. And then we have the Antay-Bantayan in that 16 story. So I think with that, Mr. Chairman, let me commend Director Legaspi for initiating all of these activities and these programs and the master plan, and implement it very well. So with that, Mr. Chairman, I would therefore ask for support from my colleagues for this bill. It's not only 100 million, we ask for 200 million budget for the anti-bantai. We can give more to the 16-story. It's how much does the 16-story require in terms of how many billions?
Okay. Sir, the 16-story building is aimed to be pandemic ready also. So because of the experience of this COVID, we are designing a building that can be converted to a COVID or to a pandemic facility overnight. No? So all the hallways, the passageways, and the rooms will be negative pressure. So this will cost around 2.2 billion po when it's finished. So far we have, I think we have put together around 70% of the cost of this building. And we are ready to break ground anytime this first half of the year.
Thank you. So 2.6 billion, that will be very good towards the health of our people. So another 200 million here with this bill being approved will go a long way also in helping you have this. Mr. Chairman. Thank you, Mr. Chairman. Thank you.
Thank you, Deputy Speaker. Before we proceed, may we acknowledge the presence of Vice Chair Alexis, Congresswoman Alexis Tutor, Vice Chair Congresswoman Resurrection Apop, Vice Chair Congresswoman Dalia Loyola, Vice Chair Congresswoman Ruth Mariano Hernandez, Congresswoman Cheryl Deloso Montalia, Congressman Alberto Pacquiao, Congresswoman Irene Saulog, and Congressman Jericho Nograles.
Mr. Chair, I would like to ask Dr. Legaspi, how much is the budget approved for PGH this 2021, Mr. Chair?
For 2021, Congressman, it's 6.8 billion po for this year.
6.8 billion for PGH.
For PGH.
With this plan of yours of 16-story building, how much was allocated for this from the 6 billion budget for PGH?
We were fortunate to have 600 million included in the 2021 budget po.
Okay, that's good.
But just to be transparent with you,
I
I
should
was
be
able.
aware of that because I sit in the board of
Oh, yes.
yeah, we approved that budget. Yes.
And also, you also remember that 700 million was given by private donors
Yes,
for it.
that's right.
And then we have, yes. So
I think,
we will be able to complete this.
Okay. So, having said that, Mr. Chair, at this point, I would like to move for the approval of the bill of Congressman or Deputy Speaker Rufus Rodriguez, House Bill 1844, an act authorizing the construction. Probably we just have to rephrase this because now the building is there already, of a Bantay-Antayan building in front of the Philippine General Hospital. Emergency
Before we,
Motion to approve the bill of Kong Rufus for the Bantay-Antayan building. To include it in the
Motion.
Madam Chair, before I second the motion, Madam Chair, may I ask that the members present here be made as co-authors of the bill, Madam Chair.
so there's a move that all members present be made co-authors of the bill. Do I hear a second?
Second motion.
Second. Yeah.
Motion is
Second.
carried.
Mr.
Before we
Chairman,
approve,
as
before
amended,
we,
200 million, Mr. Chairman. It should be as amended. It should now be, because my bill is 100, it should be at least 200 million.
okay, before we
Thank you.
approve the House Bill number 1844, I would like to ask the Chair, UP College of Medicine Dean Charlotte Chong, his comment.
Good morning, Chair Congressman Jun Gato, and of course the distinguished members of the House of Representatives. As Dean of the UP College of Medicine, I'm very well, of course, supportive of this move. Sabi ko nga po, kung ano po nakikita natin sa PGH, yun po ay pwedeng sabihin na tanda ng pagmamahal ng ating mga namumuno para sa mga taong bayan. So kung makikita po natin na sila ay naghihirap sa pag-aantay sa labas ng PGH, ay nakikita natin na sila ay hindi na masyadong naalagaan. With this Bantay-Antayan, it will just manifest how much we care for the Filipino people. We would like to not only support the patients, but of course their families, especially from faraway places. But we would like also to manifest as the UP College of Medicine. Diyan po nagtitrain ang mga ating mga doktor, medical students, residents, and fellows. At nakikita po nila kung naghihikaho sa mga pasyente dyan. At lalo na kung walang pambayad, walang pagkain, nakikita nila na bakit ganito ang ating bayan. At kung makikita po nila na ito ay napapangalagaan, lalo po maiintig ang kanilang damdamin na ang ating taong bayan, mapagsilbihan nila ng gusto. At sila ay makapag-focus sa pag-aalaga sa mga pasyente. Imbis na kuminsan po kasi ay sila pa ang bumibigay ng mga pangmerienda at saka bayad para sa gamit at kuminsan po ay pambili po ng pamasahe o kaya ay pagkain. So ngayon po na mayroong magiging ganitong kaayusan, ay alam ko po na magiging napakaganda pong ehemplo sa ating mga future doctors of our country that we're able to take care of our countrymen. Maraming salamat po sa inyo.
Thank you very much, Dean Charlotte Chong. So we go back to the approval of House Bill number 1844. There has been a motion to approve House Bill number 1844 with amendment.
Mr. Chairman.
Sir, motion to approve 200 million.
So there is a
200
motion to
million.
approve and duly seconded.
For
Do I hear
Bantay-Antayan.
any objection? Hearing none, the motion is approved. Congratulations, Dean and Deputy Speaker Rufus Rodriguez.
Thank you very much, Mr. Chairman, and all our distinguished colleagues who are now co-authors. Thank you for supporting this, and of course, Chairman Go and Vice Chair Marilu for moving and seconding this, and also Congressman Gil Acosta. Thank you very much.
Thank you. We now proceed with House Bill number 2677. May hear from Congressman Wilfredo Inverga for his sponsorship speech. Congressman Inverga present?
Mr. Chair, I think wala siya. May I take the cudgel of presenting the bill of Congressman Imberga
Yes,
on
Congressman Mark.
Yeah, I would like to move that the explanatory note of House Bill 677 an act providing for the rehabilitation and modernization of the Philippine General Hospital, creating PGH Rehabilitation and Modernization Fund, appropriating funds therefore and for other purposes, be adopted as the sponsorship speech of Congressman Imberga. I so move, Mr. Chair.
Thank you, Congressman Mark. Comment from Director Gap Ligaspi.
Thank you very much allowing us again to with the House. The modernization and rehabilitation bill will surely come in very supportive of our, as I said, 20-year master plan for PGH. As it is now, may I just update the Congress that the PGH now is in, I've been director for, this is my 6 years director, and we have pushed for this. The master plan actually involves both restoration of the historical sites and landmarks in PGH and the modernization of PGH as well. So just to share with you, so far we have now, with the support, with the big support of government, we have now surpassed a lot of hospitals in terms of equipment. In fact, there are equipment in PGH that are only present in PGH and no other hospital in the country, and maybe only the second in Southeast Asia. And this modernization plan is still in its through its full fruition in the next few years. The modernization and rehabilitation come hand in hand with the plan to expand the walls of Ermita. So very complementary to the PGH, serving various areas in the country with the high standards of care, advanced care, as well as backed by research and the skills of our graduates. So I saw that the budget allotted for it is 1 billion a year, and that is just enough for us to be able to upgrade equipment that are getting outdated, and also get procure new ones that will bring us in the forefront of medicine. The goal now for PGH is for internationalization. So our first goal is to make it able to give high quality service to our indigent patients. If I may share with you, from cardiac surgery to brain surgery to prosthesis that costs $500,000 pesos. So we're able to give that with the support of the government. And now what we want to do is expand PGH in an entire international setting. That's why, which is based on technology and skills advancement. So I think the bill will be will set us into good motion. We have one installed called the high focus ultrasound that is used to treat Parkinsonism and tremors, which is now being our gateway to international patients. We have Hong Kong wanting to have this equipment, the use of this equipment. So as I said, after serving our constituents from all over the country, I think it's now time to go international and put PGH one notch where it is now. Thank you very much for this bill, sir.
Thank you, Director Gap. Comment from other resource speakers? From DBM?
Mr. Chair, magandang umaga po. Hello?
Hello, please.
Hello, Mr. Chair.
Yes, resource person from DBM.
Yes. Hello, good morning, Mr. Chair.
Good morning, resource Miss Bernardita Chua. You're
Yes, sir. Good morning,
recognized.
Mr. Chair, and good morning po sa lahat. Opo. Although we find the bill laudable, Mr. Chair, we would like to put forward the comment of our bureau in charge of the University of the Philippines system. On Section 6, Your Honor, on the PGH Rehabilitation and Modernization Fund allocation of 1.0 billion, may we emphasize that Section 25(4), Article 6 of the 1987 Constitution prescribes that a special appropriations bill shall specify the purpose for which it is intended and shall be supported by funds actually available as certified by the National Treasurer or to be raised by a corresponding revenue proposed therein, Mr. Chair. Thank you.
Thank you, Ma'am Bernardita. Comment from the DOH representative.
Thank you, Mr. Chair. Good morning, everyone. So,
good morning, Roderick. Mr. Roderick Napulan.
With your permission, Mr. Chair, may we request Mr. Glenn Cruz to read the technical paper that we formulated relative to the House Bills 2677, as well as the other three bills, Mr. Chair, the House Bill 6789, as well as 7177. And we would like also to manifest, Mr. Chair, in the previously approved bills on the House Bill number 1844, that is authored by Deputy Speaker Rufus Rodriguez, if we could consolidate these bills together, together with the other three House bills relative to the PGH modernization and upgrading, and include that as part of the section na lang po yung bantay antayan. And maybe we can also consider po yung this bantay antayan will also serve as the dormitories for those trainees coming from the regions as well as in provinces, since the DOH is now developing also the specialty centers in the different regional DOH hospitals, like in the Baguio General Hospital and in Davao Regional Medical Centers, so that the trainees will have a comfortable as well as better dormitories and houses then po when they are in training in Manila.
Mr. Chair.
Congressman Mark, you're recognized.
Yeah, I would like to suggest, therefore, that we ask the proponents of House Bill 6789 and 7177 to present these bills, and we will get the overall comments of DOH and the other agencies with all these bills, because these are all interrelated and they're all focused on one hospital, and that is the hospital of the country, Philippine General Hospital.
Yes, Congressman Mark. I was about to say that because House Bill 2677, 6789, and 7177 are similar, so maybe we can present the other two before we hear the comments from the resources speaker. So may we now recognize Vice Chair Christine Tutor to sponsor his House Bill number 6789.
Yes, Mr. Chairman. Good morning. I would like to I move that for House Bill number 6789, titled Increasing the Bed Capacity of the Philippine General Hospital from 1,500 beds to 2,200 beds, and appropriating funds thereof, that my explanatory note be adopted as my sponsorship remarks. So move, Mr. Chair.
Thank you very much, Vice Chair Christine Alexi. For House Bill number 7177, may we now recognize Congressman Alfred Vargas for his sponsorship speech. Is Congressman Alfred around? Maybe Congressman Mark can
Yeah, okay. Yes, Mr.
on
Chair,
his behalf.
thank you very much for this opportunity. I would like to request that the explanatory note of House Bill 7177 be adopted as the sponsorship message of Congressman Alfred Vargas. I so move, Mr. Chair.
Thank you very much, Congressman Mark. So, comments from DOH again, Mr. Rod Napulan.
Thank you, Mr. Chair. With your permission, Mr. Chair, may we request Mr. Glenn Cruz to read our technical paper? Thank you, Mr. Chair.
Mr. Glenn Cruz, you are recognized.
Yes, good morning, Mr. Chair. I'd like to read the DOH technical paper for House Bill number 1844, House Bill number 2677, House Bill number 6789, and House Bill number 7177. The Bureau offers its commendations to the Philippine General Hospital, the National University Hospital, in its demonstration of leadership and commitment to service, especially for patients and families in most need, and especially in its role as the COVID-19 referral hospital. The Health Facility Development Bureau and the Department of Health interposes no objections to the proposed measures. They all commonly seek to ensure responsibility of healthcare and patient-centered services in the hospital. But we would like to additionally recommend the following in this respect. First, as mentioned by Mr. Napulan, we recommend that the House Bill numbers 1844, 2677, 6789, and 7177 be consolidated into one that will address the expanding of the capacity and upgrading of the service capability of the PGH, including all the improvements in its facilities and professional health care that befits the National University Hospital. Second, the consolidated bill should contain that the PGH shall formulate its development plan with a time frame that prioritizes the progression of the expansion, upgrades, buildings, and facilities, and to contribute in strengthening the referral network and the hospital's role as end referral multi-specialty facility. This will be consistent with the Philippine Health Facility Development Plan towards universal health care. Third, in the planning and design of the PGH complex or complexes, guidelines in green, safe, and climate resilient building for health should be considered, including other national and international health standards and regulations. Fourth, in the implementation of the development plan, continuous or undisrupted provision of hospital care services should be ensured, with due consideration to the needs and the functioning of the healthcare provider networks that are linked to the PGH. And finally, we would like to recommend that an initial amount of appropriations be identified with the due consideration of the priority critical areas in the direct provision of healthcare, as well as the safety of the health workers and patients in a country that is transitioning towards the new normal. Additionally, we would like to recommend that our department, the Department of Health, differs from the matter of appointing the Secretary of Health in a body to be created in overseeing the development of the PGH. We think that this shall be a matter of the University of the Philippines Board of Regents or the UP President, consistent with the UP Charter or Republic Act number 9500. But all the same, the DOH guarantees that it will, in any capacity, by the Office of the Secretary or the Secretary Representative, that the DOH will extend the necessary assistance to the PGH in the formulation, implementation, and even the monitoring of this plan. So respectfully submitted. Mr. Chair.
Mr. Chair,
Yes,
may I make a comment on the position of the Department of Health, Mr. Chair?
Yes, you're recognized, Representative Mark.
Yeah, well, first, I agree that we consolidate the four bills with the strong focus of strengthening and expanding the services provided by the Philippine General Hospital. And probably House Bills 6789 and 7177 will address this focus by increasing its bed capacity from the proposal of our two proponents from 1,500 to 2,200, and this will incorporate the Bantay-Antayan building plus the modernization as well as rehabilitation of certain areas of PGH. But on the other hand, I would like to express my not really disagreement but my reservation on the role of DOH in supervising the implementation of this particular plan. I think this is going to be left to PGH and the Board of Regents of the University of the Philippines, considering that we have a charter in UP that defines what is expected of this body. No? Having said that, Mr. Chair, I would like to request that the Department of Budget should express its agreement also with the suggestion that we will increase the bed capacity of PGH from 1,500 to 2,000 as well as DOH, and the corresponding budget be allocated for this purpose, Mr. Chair.
Thank you, Congressman Mark. May we hear comment from DBM, Ma'am Chua, Ma'am Bernadette Chua.
Sir, if I may turn the microphone to one of my colleagues who are in charge of the plantilla positions for PGH, sir, from OPCCB. We have representative from DBM OPCCB, sir.
Yes. Hello po. Good morning po, sir. Honorable. As regards po to the OPCCB position po, we have yet to prepare our position paper on the matter. But we defer to, but our initial comments po is we defer to the DOH in determining the need to upgrade the bed capacities of existing hospitals based on standards. Thank you po.
Maybe
additional na po.
Can you please submit your position paper to the committee as soon as possible?
Yes, sir. We will submit po. Yes, sir. We will submit our position paper to the committee.
Next week, perhaps?
Sir, I will coordinate po with our department legislative liaison office for that. Thank you.
Okay. COMSEC, please take note.
Mr. Chair, can we ask DOH on their stand on this?
DOH, Mr. Rod. Mr. Napulan from DOH. Wala.
Yes, apologies, Mr. Chairman.
Yes, Mr. Cruz.
We just have experienced a brief disconnection. Can we just get the question again so that we could state our comment?
Yeah, one position that we would like to take from DOH is on the increase in the bed capacity of PGH from 1,500 to 2,200.
Yes, thank you. Thank you, Representative Go. The DOH interposes no objections, and we fully support the measure.
That's good.
Okay, thank you very much. May we hear from the representative from PGH and UP College of Medicine, whether the increase in the number of beds, which will mean an increase in the number of consultants, teachers, and number of medical interns, will this not compromise the quality of teaching and training in the hospital?
May I be given the floor, Congressman?
Yes, Dean Charlotte.
Yes, as you know, the Philippine General Hospital is the foremost and premier training hospital in the country, and it's the clinical laboratory of all the students of the UP College of Medicine. And much of the training that happens there is because of the quality of instruction that's given by the faculty of the UP College of Medicine, of which we now have around 768. But I would like to manifest the fact that about almost like 200 to 300 of our faculty members give services and train and teach medical students without any salaried position. They do this with very minimal honorarium. And with the increased capacity of medical schools with the Dr. Sabayan bill, we were actually given about 100 million, but we were only given, I think, 40 million to increase the number of faculty. And that would only be good for Professor 1 level, around 25 faculty members. So if you increase the bed capacity of PGH by almost like 50%, from 1,500 to 2,200, this will mean more residents will be needed and perhaps more faculty members in order to supervise properly the services as well as the training of the future specialists and doctors of our country. So we would like to manifest from the UP College of Medicine the fact that if we are to increase the number of beds of the Philippine General Hospital, please bear in mind that we may have to also give the support for personnel and faculty items, and we would like to request the DBM to include this in their plans, because we would like to ensure that we have more faculty members who are able to be given the proper compensation for the work that they do at the Philippine General Hospital, in consonance also with the vision of the UP College of Medicine to maintain its leadership in community-oriented medical education that is actually directed to the underserved. Ito po ang vision and mission of the UP College of Medicine. Leadership in community-oriented medical education that is actually directed to the underserved. Maraming salamat po.
Thank you, Dean.
Yes, by Chair June.
Yes, Congressman Mark.
Yeah, once we approve the increase in the bed capacity, there will be corresponding improvement in the faculty, doctors, nurses, facilities, equipment, including the building required to accommodate 2,200 beds. So we will ask you after this bill is approved to tell us how much would be the additional probably budget, manpower, equipment, tools that will accommodate this increase in the bed capacity. Mr. Chair.
Thank you, Congressman Mark. Any other comments?
Mr. Chair.
Resource person?
Mr.
Yes,
Chair,
Director Gap.
Okay. Thank you very much for this bill again to increase our authorized beds by 700. Just to officially put it, the official authorized bed of PGH is 1,334. So the additional 700 beds will make it 2,034 rather than 2,200. So as shown in the master plan, there will be 4 buildings that will be going up around PGH, and in the very near future, the multi-specialty building is coming up. And this morning we are presenting to the NEDA ICC the PPP proposal for the cancer center, which is going to be built on the Padre Faura side of PGH. So that's going to be another 300 beds also. So these two buildings already have 600 beds additional space for our patients. So that's why we this early we are thinking of asking for additional beds to prepare us for this eventuality of having this service areas opened in the next 2 or 3 years. As it is now, our bed capacity at 1,334, we forces us to refuse some of the patients that we cannot give beds to anymore, or maybe force us also to put them in areas that are not fit for patients to stay in. So hence the plea for more beds for our patients. Of course, together with the infrastructure development, this will truly expand our capability to serve more. As I said in the beginning also, the PGH that we know it now is going to be different maybe in the next 3 or 4 years as we expand PGH and integrate all its health services. So we are envisioning a UP health system wherein we'll have more than one Philippine General Hospital facility. And of course, sharing of this manpower will ease the transition to these other facilities. So the timeliness of this bill cannot be overemphasized, and I'm really expressing my appreciation for it. As far as teaching teaching and research are concerned, we very well know the number of patients and the number of subjects in teaching or in research activities make the output even more credible. And I think this will add to the fact that as leaders in research, we need more areas where we can have an opportunity to apply it. So thank you very much for this bill. And in partnership with the College of Medicine, the Philippine General Hospital truly will be able to fulfill its mandate of service, training, and research to the country. Thank you very much.
Thank you,
Mr.
Director
Chair,
Gap.
I have a question to Dr. Legaspi. Is
Yes,
our
Congressman
plan
Mark.
to put up another PGH in UP Diliman part of the overall plan of this increase in bed capacity of PGH, Dr. Legaspi?
Yes, yes, Congressman. It's all integrated. The putting up of another PGH is not a separate operation. It will be integrated operation. So the fluidity of manpower services will be planned for both facilities.
Okay, thank you.
Thank you. Any other comment? So are we going to consolidate the 4 bills or only the 3 bills? The bill on rehabilitation, the 3 bills on rehabilitation and modernization? Or are we going to include also the bill on the construction of the Bantay-Antayan?
Mr. Chair, I think we need to ask our Deputy Speaker because this bill has already been approved by this committee before we tackled items 2, 3, and 4 of the agenda. DS Rupos, they are suggesting that the Bantay-Antayan building is part of the overall plan of PGH, and that to operationalize this, we need the budget. But DOH is saying that the increase in the bed capacity plus putting up a rehabilitation and modernization fund would mean that all of these things should be integrated into one bill, including, of course, the very important Bantay-Antayan building that will be constructed as we earlier approved.
Deputy Speaker Rufus.
Can you unmute?
Yes, thank you, Chairman Mark and Chairman June. This is quite a unique bill, which has a very unique feature and a unique name, and that is why I would rather that this continues to be a separate bill. After all, administratively, this can be integrated as we have discussed earlier. So I would wish that while we will consolidate the three other ones, my bill stays, because this will be really be known as there will be a bantay-antayan. This is really for the poor people, not very much for those who can really afford, but for those who cannot go home, relatives who are very poor. They just are lying there, and elements of the under the elements. So ours is really to emphasize that we care for the poor, and that we want to have this particular bill announce that there will be a place where they can stay. So that is my request, that this bill be standalone, Mr. Chairman.
Thank you very much, Deputy Speaker. So do I hear a motion to consolidate the three other bills?
Motion. I move, Mr. Chairman, to consolidate the three bills to be one consolidated bill, and I move for approval, Mr. Chairman. And that all those present, Mr. Chairman, be considered also as co-authors of this very, very significant, important measure. Thank you, Mr. Chairman.
Second the motion, Mr. Chairman.
There is a move to consolidate House Bill 2677, 6789, 7177 into one substitute bill, subject to style and amendment, and to include all present to here in this meeting as co-authors. Duly seconded. Is there any objection?
Mr. Chair,
Chairman,
just one
Mr.
clarification. I would like to propose an amendment to the motion that we approve in principle these three bills, but they will be consolidated, and we will use House Bill 6789 and 7177 as the reference bills for these consolidated bills, Mr. Chair.
Second the motion, Mr. Chair.
Okay, there is amendment to the motion. The amended motion states that there will be a consolidation of the three bills with House Bill number 6789 as the template bill.
And 7177, they are the same basically, Mr. Chair.
Duly seconded. Hearing no objection, the motion is carried.
Mr. Chairman, Mr. Chairman.
Yes, Congressman Mayo.
Yes, Mr. Chairman, good morning. I just would like to make sure that my presence in today's committee is recorded, so that I will be one of those made as co-authors of this bill, Mr. Chairman.
Sorry, Congressman Mayo. We'd like to acknowledge the presence of Congress Mayo in today's meeting.
Thank you.
Thank you. We now proceed to the other bills this morning. The upgrading the Davao Regional Medical Center. May we now hear Congressman Jericho Nograles for his sponsorship speech.
Thank you, Mr. Chairman. Thank you, honorable members. I have the pleasure and honor of sponsoring, along with Congressman Mayo Almario and along with former Speaker Bebot Alvarez, the upgrading of the Davao Regional Medical Center from 600 beds to 1,000 beds. A lot of people do not appreciate that the Davao Regional Medical Center in Apocon, Tagum City, is actually the cancer center and the only kidney transplant center in the island of Mindanao. They are run professionally by a great team of doctors and managers, and we have worked with them for many years, and we believe that it is time to expand their bed capacity so they can serve more patients, and especially this time of COVID. They have managed many cases, including cases of the UK variant in a very professional manner. And I hope that this committee will consolidate the three bills and push for its approval. Thank you very much.
Thank you very much, Congressman Jericho. May we hear now from Congressman Pantaleon Alvarez for House Bill number 7047 for his sponsorship speech. Congressman Alvarez.
Mr. Chair.
Yes, Congressman Mark.
Yeah, I would like to sponsor the bill of our former Speaker Pantaleon Alvarez. This is House Bill 7047. It's basically a similar bill with that of Congressman Nograles, an act increasing the bed capacity of the Davao Regional Medical Center from 600 to 1,000 beds, upgrading the service facilities and professional healthcare therein, and appropriating funds therefore, that the explanatory note of said bill be adopted as the sponsorship speech of our former Speaker Pantaleon Alvarez. I so move, Mr. Chair.
Thank you, Congressman Mark. Congressman Mayo Almario for his sponsorship speech on House Bill number 7350. You are now recognized.
Thank you, Mr. Chairman. Mayong buntag sa tanan. I would like to read into the records my explanatory note as my sponsorship speech for the consideration of this committee of House Bill number 7350, which is also similar to the House bills filed by former Speaker Pantaleon Alvarez and by my idol Coco Nograles, Mr. Chairman. The Davao Regional Medical Center is a government tertiary training hospital located at Tagum City, Davao del Norte, serving patients from Davao de Oro, Davao del Norte, Davao del Sur, Davao Oriental, Surigao del Sur, Surigao del Norte, Agusan del Norte, and Agusan del Sur, among others. Those are 8 provinces, Mr. Chairman. DRMC was previously operating on a daily bed capacity of 200 while catering to the needs of implementing almost 700 actual daily bed census. The disparity was so glaring that it exerted a tremendous burden on its operational system, thereby affecting and compromising its capability to expand various health services. As a result of the demand-driven services that DRMC has rendered among the people and community within its catchment areas, it paved way to the creation of the Republic Act number 10678, an act converting the Davao Regional Hospital into Davao Regional Medical Center, increasing its bed capacity and appropriating funds, therefore, amending for the purpose Republic Act number 7179, which increased the bed capacity of Davao Regional Hospital from 150 to 200 beds. Therefore, however, the DRMC continues to contend with an average of 850, as of the moment, inpatients a day, far exceeding its 600-bed capacity. Today, the DRMC provides top-notch health services to the region and has contributed significantly to Mindanao's health sector development. It holds the distinction of being the first cancer center in Mindanao and has an accredited kidney transplant program. Mr. Chairman, to add to the explanatory note, let me put also on the record that the Davao Regional Medical Center is a referral hospital of patients coming from other provinces with hospitals not capable of attending to patients needing higher level of medical attention. So like for example, at the Davao Oriental Provincial Medical Center, once our hospital receives patients whose medical case cannot be attended to, automatically we refer them to the Davao Regional Medical Center, Mr. Chairman. So that is also true for the other provinces, relying on the expertise of DRMC. And one greatest contribution of DRMC, Mr. Chairman, is that it also decongests hospitals in Davao City, especially the Southern Philippines Medical Center, or SPMC. So the patients no longer need to be taken to the center, to Davao City or to SPMC, because they are well attended at the DRMC. But again, the problem is the lack of beds. Therefore, I earnestly ask this committee to give its due consideration and approve House Bill number 7350, along with the House bills filed of similar nature by former Speaker Pantaleon Alvarez and Congressman Jericho Coco Nograles, Mr. Chairman. Thank you. And for the record, Mr. Chair, the Chief of Hospital, Medical Center Chief 2, Dr. Brian Dalid, is also with us on Zoom this morning. Thank you.
Thank you very much, Congressman Mayo. Can we now hear a comment from maybe Dr. Brian Dalid from Davao Regional Medical Center?
Good morning, Mr. Chair, Your Honors, my sponsors, especially Congressman Coco Nograles, Congressman Mayo Armario, and former Speaker Pantaleon Alvarez. Davao Regional Medical Center, sirs and ma'am, is one of the two retained tertiary hospitals in Region 11, no, as mentioned by Congressman Almario. The other being the bigger one, the Southern Philippines Medical Center, which practically takes care of the whole of Mindanao. Now, for the record po, Davao Regional Medical Center centers catchment area immediate po is Davao Oriental, Davao de Oro, Davao del Norte, Tagum City, and the Island Garden City of Samal, with patients coming from Bukidnon, Agusan del Sur, Agusan del Norte, Surigao del Sur, and Surigao del Norte. Because the retained hospitals in Region 13, which is located in Surigao City and in Tandag, Surigao del Sur. So medyo mas malayo po siya if the patient is coming from the boundary municipalities. DRMC is nearer than their retained hospital in their region. Now, there are practically, among others po, 4 reasons why we want DRMC to be increased in terms of bed capacity and budget. Una po, we are a COVID referral hospital. At present po, we are running 3 2-stories isolation facility. As we speak po, we have 200 inpatients, all COVID, and 70 of that are positives. For the past year po, we have 112 deaths already. Now, having said that, na meron po kaming 3 mini-maintain na 2 stories na facilities, COVID facilities, kailangan po namin ng increase ng manpower po and budget. Mabangkit ko lang po na meron pang kaming na 2 na facilities for COVID, and that is, the one is from Bayanihan 2, and the other one is from ADB. So the more po na kailangan namin ng budget at manpower. Second po, we are the apex hospital for universal healthcare. As we all know po, na-approve na siya last year. Nag-start na po ngayon yung universal healthcare. And we are the apex hospital of 2 advanced site, implementation site of UHC, which is Davao del Norte and Davao de Oro po. Third po, starting 2017, gaya ng sinabi po kanina ni Sir Roderick Napulan, nag-start na po ang Department of Health decentralizing specialty centers. And ang napunta po sa Davao Regional Medical Center are the following: Cancer Center, Kidney Center, Brain and Spine Center, Geriatric, Orthopedic, and Eye po. So kailangan din po namin ng increase ng manpower at budget po nito. Lastly po, 2 years ago po, we opened our extension hospital in the municipality of San Isidro. This is a geographically isolated and depressed area po.
So we are running the hospital using the budget of the main hospital. That is why we are asking po this your honors na madagdagan po ang aming bed capacity and budget para ma-maintain po namin ang operation ng hospital na ito. These are the reasons po, the main reasons that we want our hospital to be upgraded, among others po. Thank you very much po.
Thank you, Dr. Brian. Comment from Dr. Annabel Yumang of the DOH Regional 11. Dr. Yumang.
Yes, sir. Good morning, sir.
Good morning.
Good morning po, sir. Thank you so much, sir, for the recognition. So I would like for the Department of Health, sir, Davao Region. So we commend also, sir, no, for the praiseworthy efforts of our Davao Regional Medical Center in its provision of quality medical services to its constituents. Furthermore, the Center for Health Development finds no objection for DRMC or Davao Regional Medical Center in increasing its bed capacity from 600 to 1,000 beds capacity, provided that the government hospital complies with the DOH application procedures in the upgrading of its authorized bed capacity. However, and also, the Health Facilities and Services Regulatory Bureau sets the minimum standards for the regulation of health facilities, So the DOH Department Memorandum number 2019-0112 with the subject of DOH FSSRB QOP 01 form, the new and renewal application, as well as the Form 2 and its amendments may be used as a reference for its application. So that also the CHD recommends that the human resource complement to man the increase in its beds is ascertained to in order to continuously deliver the delivery of top-notch and accessible healthcare services to its patients. Nevertheless, the CHD is willing to provide the necessary technical assistance in the operationalization of this hospital, provided that this complies with the DOH regulatory and licensing requirements. So that is our position po, sir, with regards to the increasing of the bed capacity of Davao Regional Medical Center to 1,000 bed capacity. Thank you so much, sir, for this consideration.
Thank you, Dr. Yumang. Comment from DBM.
Yes. Good morning, sir. Your Honor, this is Jane Abelia.
Yes, Ma'am Jane, you
Yes,
are
sir.
recognized.
Yes, sir. We support the approval of the proposed bill on the additional bed capacity of the Davao. However, we would like to manifest the following comments, sir, if you would allow us, sir. By the way, sir, this is just a bureau position paper. The official position paper still have to be vetted by our principals. If you would allow me to proceed, sir.
Briefly, Ma'am Jane.
Yes, sir. On the increase in the medical personnel resulting from the additional bed capacity, there may be a need for the evaluation of the appropriate staffing pattern by our OPCCB in accordance with the existing standards on organizational structure and staffing pattern of government hospitals. On the funding for the hospital facilities and equipment upgrade, the same may be proposed for inclusion programming under the Health Facilities Enhancement Program, consistent with the Health Facility Development Plan, subject to annual budget process. The hospital generated income may be tapped to augment the hospital MOE and capital outlay requirements. Further, sir, the DOH is adopting a normative financing to consider the operating requirement of the hospitals. The normative financing considers the outpatient, the inpatient, and all incomes being received by the hospital. It may come from PhilHealth, from payment of the patients, and other fees that are being collected by the hospital. That's all, sir. Thank you very much, sir.
Thank you, Ma'am Jane. Please submit your position paper.
Yes, sir,
to
we
the
will do.
committee? Thank you, Ma'am Jane. Any other comment from our resource persons?
Motion for approval.
Congressman Mark?
Yeah, Mr. Chair, hearing our proponents of the three bills as the comment of the Department of Health and the Department of Budget, I move that we approve the three bills as presented. And we will come out with a committee report consolidating the three bills, Mr. Chair. I so move.
The motion, Mr. Chairman.
There is a motion to consolidate the three bills, House Bill 6993, 7047, and 7350. Duly seconded. Hearing no objection, the motion is carried.
Mr. Chairman.
Yes, Congressman Mayo.
Yes, Mr. Chairman, thank you very much. And I would like to thank also the members of this committee, Congressman Mark Go, and all the rest. Before the committee moves on to the next item in the agenda, I'd like to take this opportunity by also thanking Dr. Dalid for taking care of patients referred to DRMC coming from the province, my province, Mr. Chairman, Davao Oriental. And I'll also put on notice that I will be calling Dr. Dalit after this meeting to discuss with him the possibility of DRMC also extending its services to other places, not just in San Isidro, Davao del Norte, but also in remote barangays in Davao Oriental. Thank you, Mr. Chairman. I can see Dr. Dalid nodding, and I will be coordinating with him. Thank you very much.
Thank you, Congressman Mayo. We move on to the next item, the local House bills. We now tackle House Bill number 1621. Congressman Hil Cabarangay Acosta Jr. for your sponsorship speech.
Thank you, Mr. Chairman, in behalf of my two other colleagues from the province of Palawan, Congressman Cyril F. Abueg Saldivar of the 2nd District and Congressman Francisco Alvarez of the 1st. Mr. Chair, this bill was already filed in the 17th Congress, Mr. Chairman, as House Bill number 450. In fact, this is the pet bill of the former Congressman of the 3rd District of Palawan, my father, the original Cabarangay, Hil P. Acosta. However, due to lack of material time and due to the stroke of my father, Mr. Chairman, this bill was not approved on the 3rd reading, Mr. Chair. Palawan, Mr. Chairman, is the largest province in the whole Philippines. For the past 3 years, it has been hailed as the best island destination in the world. We are a tourism-dependent economy, Mr. Chair. And one of the milestones in terms of tourism is having a big hospital in the province, composing of almost 1,500,000 as of 2019, Mr. Chairman. All of cases, being it poor, rich, bata, matanda, Mr. Chairman, we all go to Manila. Very far away, Mr. Chairman, from tip to tip, from the Straits of Mindoro, bordering the province of Mindoro in the Calamianes Islands, Mr. Chair, from down south of the province, bordering Malaysia to the Balabac Straits. From tip to tip, Mr. Chairman, the province of Palawan is 800 kilometers long. Not considering the fluvial domains of the province, which consists of 13 municipalities that are island municipalities, not including, Mr. Chair, the barangays that are found in the province. The Philippines, Mr. Chair, has 7,100 islands, more or less. And 1,700 of those islands are in Palawan, Mr. Chair. There is really a need, Mr. Chair, for a medical center in the province of Palawan to be put in the center of which is within my district, Mr. Chair, the city of Puerto Princesa. Although, Mr. Chair, this has been already approved in the last Congress, Mr. Chair, consultations with our distinguished Madam Chairperson, Congressman Helen, Mr. Chair, I have some amendments to the bill, Mr. Chairman. Because in the bill, Mr. Chair, it is entitled an act creating a body corporate, separate and distinct from the DOH. But upon consultation, Mr. Chair, with our chairperson, Madam Congressman Helen, Mr. Chair, what she suggested was to just defer that the corporate body be erased and the title be replaced that an act establishing the Western Philippines Medical Center, a regional medical center in the province of Palawan within the city of Puerto Princesa, Mr. Chairman. And also, I would like to adopt the other points in my explanatory note, Mr. Chair, as the sponsor speech of this bill, Mr. Chairman. Thank you.
Thank you, Congressman Hill. Just to clarify, is the center that you are proposing be under the DOH or will be under the LGU?
DOH, Mr. Chairman. In the last Congress, Mr. Chair, supposedly the title of this bill would be a regional medical center. However, Mr. Chair, the regional center of our province, of our region, is in Calapan. So there are some disagreements that the regional center should not be made, so that we change it from Western Philippines Medical Center, Mr. Chair. But you are correct, Mr. Chair. Before, it is a body corporate, separate and distinct from DOH. But however, I would file a substitution, Mr. Chair, for it to be under the administrative control of the Department of Health, Mr. Chair.
Okay, thank you very much, Congressman Hill. Comment from DOH, Mr. Rod.
Mr. Chair, may I be recognized? Glenn Cruz representing Mr. Rod Napulan.
Yes, Sir Glenn.
Yes. Good morning again, Mr. Chair. Considering the comments from the author, Representative Hill Acosta of House Bill number 1621, on behalf of the Department of Health, the Health Facility Development Bureau respectfully reserves its further comment until the substitution bill is actually served in the committee. Thank you very much, Mr. Chair.
Thank you, Mr. Glenn. Comment from the principal main author, Congressman Hill.
Mr. Chair, although I would be filing a substitute bill, Your Honor, I would ask our dear colleagues that there is a pro forma in terms of creation of a regional medical center, Mr. Chair. I would like to ask that our dear colleagues, Mr. Chair, for in principle, that we adopt this House Bill number 1621, Mr. Chair, subject to the amendment and style of the committee report, Mr. Chairman.
Mr. Chair?
Yes, Congressman Mark.
I would like to propose that Congressman Hill Acosta will make the amendments on the floor now so that we can approve based on the amendments that he is proposing on his House Bill 1621, Mr. Chair.
Congressman Hill.
Yes, Mr. Chair. Mr. Chairman, first and foremost, I would like to amend the title of the bill, Mr. Chairman, from an act creating a body corporate to be known as the Western Philippines Medical Center and for other purposes, Mr. Chairman, into an act establishing a Western Philippines Medical Center in the province of Palawan, Mr. Chairman, and appropriating funds therefore. Likewise, Mr. Chair, with line number 13 in relation to Section 3, the Board of Trustees, it is now deemed, Mr. Chairman, that this would be erased in the bill, Mr. Chairman. All of Section 3, Mr. Chair. Likewise, Section 4, Section 5, Section 10. That's all, Mr. Chair.
They will be deleted, Congressman Acosta, from your bill.
Yes, sir. Yes, Chairman, sir. Because all of those
Can
sections
you move this into can you come out with a motion amending what you just stated, Mr. Kong Hill?
Thank you, Mr. Chairman. Mark, Mr. Chairman, I move that sections 2, 3, 4, 5 would be amended, Mr. Chair. And also, I move that the title be amended into an act establishing the Western Philippines Medical Center in the province of Palawan and appropriating funds therefore, Mr. Chair.
I second the motion, Mr. Chair.
So there is now a motion to amend the House Bill number 1621, deleting Section 2, Section 3, Section 4, and Section 10. Section 4, 5, and Section 10. And the title would now be an act creating
the Western Philippine Medical Center.
Western Philippines Medical Center and appropriating funds therefore. Duly seconded. The motion is approved.
With that, Mr. Chair, I move that in principle, Mr. Chair, that this bill be approved subject to style and amendment and in relation to its committee report, Mr. Chairman.
Any
I second
second?
the motion, Mr. Chair.
Hearing no objection, the motion is approved.
Thank you, Mr. Chairman. Salamat po. Kong Mark, my chairman, thank you. Kong Mario, dagang salamat, sir.
Thank you. We move now to House Bill number 6290. Congresswoman Divine Yu, you are now recognized for your sponsorship speech. Congresswoman Yu. Congressman Mark again.
Well, yes. Thank you very much, Mr. Chair. In reference to House Bill 6290, an act providing for the establishment of a district hospital in the municipality of Ramon Magsaysay, 1st Legislative District of the province of Zamboanga del Sur, to be known as the Ramon Magsaysay District Hospital. I so move, Mr. Chair, that the explanatory note of said bill be adopted as the sponsorship speech of Representative Divina Grace Yu. I so move, Mr. Chair.
Thank you, Congressman Mark. Comment from the DOH.
Thank you, Mr.
Sir
Chair.
Glenn?
Yes, sir. We would like to read the Health Facility Development Bureau technical paper on the matter of House Bill number 6290, but the formal DOH position paper will be submitted to the committee. Based on the 2018 population projection in the area, the bed to population ratio of Zamboanga del Sur is one bed is to 1,429. While there's a need to improve on the ratio to achieve the national recommended bed to population ratio of 1:1,000, the HFDB recommends, in this respect, upgrade the currently DOH retained hospital in the province, which is Margo Satubig Regional Hospital, instead of establishing a new facility under the direct supervision and control of the DOH. The Margo Satubig is approximately 2 hours away from the municipality of Ramon Magsaysay, and it can cater to the municipalities of Aurora, Sominot, Mitsalip, Josefina, Mahayag, and Molave. As the DOH retained hospital in the province, it is envisioned to become a referral hospital, and it's in support of the Universal Healthcare Act. In addition, we would, with this, we would like also to recommend the upgrading of the service capability of the provincial hospital itself, which is the Mazamboanga del Sur Medical Center. It is more cost-effective to upgrade existing health facilities than establishing a new hospital. Based on the proposal or the proposed measure, the 100-bed level 2 hospital will require at least 594 million pesos of capital outlay and an annual budget of 178 million for personal services and 62 million for MOE. And there are other requirements or additional requirements to establish the new hospital, like the certificate of need from the DOH Center for Health Development in Region 9 and a facility study, which would include healthcare analysis, health resource analysis, and benchmarking against DOH standards. So these recommendations we present above shall complement the implementation of the Philippine Health Facility Development Plan towards under universal healthcare for all. So we respectfully submit these comments, Mr. Chair, to the committee.
Sir Glenn, do you know how many beds is this hospital, is this proposed hospital will be?
Yes, Mr. Chair, the proposed bed capacity is 100 beds and a level 2 departmentalized hospital.
Okay. Thank you. Any other comments?
Sir, from DBM.
Yes, Ma'am Jane from DBM.
Yes, sir. We do find the bill notable. However, sir, may we emphasize, sir, kasi di ba ho, sir, sa DOH din ho pupunta yon under the supervision of DOH. Am I right, sir?
Yes.
Sir, we would like to emphasize lang po, sir, kasi ho, di ba, meron ho tayong, mag-i-implement na ho tayo ng Supreme Court ruling on the mandanas. Kasi ho, magkakaroon ho ng increase sa ating ira ho ng LGU around 234 billion, and there will be a corresponding decrease in the budgets of the national government agencies. Yun lang ho, sir. Baka ho, ma-consider lang ho natin siya as we go along the local bills.
Thank you, Ma'am Jane. Unfortunately, our author, Representative Divanu, is not present.
Mr. Chair, I would like to move that we defer action on this particular bill, and we will reschedule it in the next meeting of our committee when our sponsor is going to be present, Mr.
Any
Chair.
second? Any second?
Mr. Chair, I second the motion, Kong Ebkas.
So there's a motion to defer the discussion of House Bill number 629, considering that the author is not present. So the motion is carried. We now move to House Bill number 8274. Representative Duke Frasco is now recognized for his sponsorship speech.
Mr. Chairman, Mr. Chair.
Vice Chair Alexi.
Yes, Mr. Chair, I would like to sponsor Congressman Duke Frasco's bill, House Bill number 8274, an act providing for the establishment of a children's hospital in the municipality of Liloan in the province of Cebu to be known as the Liloan's Children's Hospital and appropriating funds thereof. And for House Bill number 8275, upgrading the Cebu Provincial Hospital in the city of Davao, province of Bohol into a level 2 general hospital to be known as the North Cebu Medical Center, increasing its bed capacity, upgrading its professional healthcare services and facility, authorizing the increase of its medical personnel and appropriating funds. Therefore, that its explanatory note be adopted as the sponsorship remarks. So move, Mr. Chair.
Thank you, Vice Chair Alexi. Comment from DOH. Sir Glenn. Mr. Glenn from DOH, any comment? Or from DBM, Ma'am Jane?
Sir, what my previous manifestation, sir, for the previous bills is the same, sir. We take into consideration, sir, the implementation of the Supreme Court ruling on mandanas, whereby the ERA will be increased by around 230 billion pesos and a corresponding decrease in the budgets of the agencies like DOH, sir.
Duly noted, Ma'am Jane.
Yeah, thank you, sir.
Any other comment? Sir Glenn from DOH.
Mr. Chair, may I ask, these are both municipal and provincial hospitals?
Yes, under LGU.
Under LGU. Okay. So I think because there are other questions that we would like to ask, may I ask that these bills will be, the deliberation on these bills be deferred until next meeting of the committee when the main sponsor of the bill is present, Mr. Chair? If it is okay with Congresswoman Tutor.
Yes, Mr. Chair. Duly noted, Mr. Chair. Thank you.
Is there a second to the motion to defer? Any second to the motion to defer the deliberation of 8274 and 8275?
I second the motion, Mr. Chair.
So there's a motion to defer the deliberation of House Bill 8274 and House Bill 8275 pending the presence of the main the author, Congressman Duke Frasco. Duly seconded, the motion is carried. So we move now to the last but not the least, House Bill number 8782. Congressman Mark Go is now recognized for his sponsorship speech.
Thank you. Thank you very much, Mr. Chair, my fellow members of this committee, and our resource persons present. First of all, I would like to thank the Honorable Chair for including in today's calendar House Bill 8792, an act increasing the bed capacity of Baguio General Hospital and Medical Center from 800 to 1,500 beds. For the information of everyone in today's hearing, during the 17th Congress, the bed capacity of BGH was increased from 500 to 800 through Republic Act 11084. And I thank this committee and all my colleagues in the past Congress for helping us enact this measure. However, to put things in perspective, at the time the said law was enacted, BGH was already operating at an occupancy rate of 144+%. As such, the increase by 300 beds merely accommodated what was already the existing situation at the time. The bill we are now proposing, on the other hand, is not just reactionary but geared towards capacity building and countrywide development. In response to the pandemic, BGH was forced to reduce to patient admission, and the limited allowed occupancy resulted in a longer list of patients waiting for admission. We are hopeful that we will soon see the pandemic end, but as we have learned the past year's experience, we can no longer settle for overly cramped hospitals as we have been used to in the past. We have to build the capacities of our regional apex hospitals and create more end referral centers distributed all over the country. For everyone's information, BGH is currently on track to implement in full 15 different specialty programs within the next 4 years. This year, the hospital will be implementing in full its cardiovascular care program. Other specialty programs lined up for full implementation include renal care and transplant, lung care, brain and spine care, orthopedic center, cancer care, infectious disease and tropical medicine, a geriatric center, and mental health, among others. It is also a residency training center currently in 16 different specializations. As it is, BGH caters not only to residents of Baguio City and CAR, but also for patients coming from Regions 1 and 2. Moreover, at present, about 80% of the hospital's clientele are indigent patients, just like Philippine General Hospital. Many of our kababayans from the north simply do not have the means to send their patients to the big hospitals in Manila to receive quality and comprehensive medical and healthcare services. We in the north also deserve access to a wider array of highly specialized medical services. BGH is already in the process of establishing these programs and positions itself as the premier referral center in Northern Luzon, offering leading-edge specialty services. Hopefully, through your help, Filipinos from our side of Luzon would no longer need to travel all the way to Manila for these services, sparing them from additional cost and inconvenience. We appeal to the members of this committee to help us invest on Baguio General Hospital for continuous innovative services, expansive training programs, and more research outputs for better health outcomes for our people. Hence, the approval of this measure, increasing the bed capacity of BGH from 800 to 1,000 beds, is earnestly sought. Again, thank you very much and good morning.
Thank you, Congressman Mark. May we now hear a comment from the DOH?
Yes,
Mr.
good morning,
Glenn?
Yes, good morning, Mr. Chair again.
We,
On behalf of the Department of Health, the Health Facility Development Bureau would like to present its technical paper with regard to House Bill number 8782. We would like to note also that the official position paper of the Department of Health will be submitted to the committee after this. Based on the highlights of our technical review, based on the 5-year development plan of BGHMC, which is from 2018 to 2022, which already considers the implementation of RA number 11084, or an act increasing the bed capacity of BGHMC from 500 to 800 beds and appropriating funds therefore. The increase in bed capacity and upgrading of the hospital facility and professional healthcare services are consistent with the Philippine Health Facility Development Plan. The performance commitments include in the development plan of BGHMC, 1, multidisciplinary specialized services for brain, eye, lungs, kidney, cardiovascular, trauma, and cancer. And 2, upgrading of infrastructure in existing facility like trauma center and the multi-specialty center. And those included under Department Order number 2021-0001, which is about the establishment of specialty centers in select DOH hospitals. With this in consideration, however, the HFDB recommends the deferment of passage of the House Bill 8782, pending the approval and signing of the DOH Hospital Bed Capacity and Service Capability Rationalization Act, which the House already has transmitted to the Senate, and until such time that RA number 11084 is fully implemented, which the 5-year development plan of the BGHMC has already indicated. This would be as these are implemented, this would be consistent with the development plan of the hospital as well as the PHFDP, or the Philippine Health Facility Development Plan, and respectfully submitted to the committee. Thank you, Mr. Chair.
Action from Congressman Mark.
Well, you know, that's the problem with this country. We are so reactive. We are looking forward on this particular bill. You know, we have right now between 50 to 100 patients that are waiting because we cannot accommodate them because of this pandemic. We are limited to accepting only so many number of patients. But if we forecast what is going to happen in the next 5 years from today, definitely the 1,500 will even not be sufficient. As I mentioned in my preliminaries, the 800 bed capacity was already fully occupied when the bill was passed into law. And we are still coping right now because we have not gotten the entire budget for this increase in bed capacity. And we are projecting with the increase of patients coming from different places, not only in CAR, but also in the entire regions 1 and 2, we have no other option except to increase our capacity. Plus the fact that, as you have mentioned, the different healthcare programs that are mandated to be executed here in BGH would require additional capacity on the part of BGH. Having said this, Mr. Chair, I so believe that this is the time. After all, we will wait for another 1 year before, or 2 years even, before this bill is going to be approved into law once we start the process today, Mr. Chair.
Thank you, Congressman Mark.
Can we hear Mr. Chair, can we hear the Regional Director of CAR, Dr. Ruby Constantino?
Dr. Ruby Constantino, you are now recognized. Dr. Constantino.
Hello, sir. Hello.
Yes.
Yes. Dr. Ruby, you are now recognized.
Thank you, Mr. Chair. So allow me to read the paper of the Department of Health Center for Development.
I think we are having problem.
Dr. Ruby?
Yes, sir.
Yes, you are recognized.
We're having a problem here.
Mr. Chair, while waiting, probably we can hear Dr. Ruñez of BGH while fixing the line of Dr. Ruby.
Dr. Ruñez, you are now recognized.
Yes, again, good morning, Mr. Chair and the members of the committee. First of all, we would like to thank our representative of the City of Baguio, Congressman Mark Go, for sponsoring this bill. Indeed, to re-echo what Kong Mark has just said, the previous bill increasing the bed capacity of Baguio General Hospital from 500 to 800 was just to accommodate what was already existing as our extra beds in the corridors and in the wards, which cannot be filled up because all our wards were already filled up. So again, the 800 bed is not really an expansion, but it's just an accommodation for what was already existing at that time. And with the designation of the Baguio General Hospital as a subnational center for many specialties, we are again anticipating more patients coming in from regions 1, the whole region of CAR, region 2, and even region 3. So in anticipation of delivering all these specialty services, we indeed are looking forward to having another round of increased need for additional beds in our hospital. So as Kong Marquez said, this bill is more as a proactive measure to adapt to the future specialty services that we will be providing here. We have listened to Dr. Gap Legaspi a while ago, and as the Philippine General Hospital caters to many of the patients around the Philippines, so is the vision of Baguio General Hospital to establish a PGH in the north so that our patients need not go to Metro Manila anymore to avail of these specialty services. Again, why Baguio General Hospital being catered to? It is because we have developed our specialty services for the past years. We have the specialists here who cannot really practice their craft without the infrastructure, without the equipment necessary. So again, we declare that our hospital is still prepared to implement all these specialties, but we need the support of the government really to expand our capabilities. Thank you, Your Honor.
Thank you, Dr. Ruñez. May we now hear from Dr. Constantino? Is she available now?
Dr. Ruby, you need to unmute your audio.
Dr. Ruby, you are recognized. Yes.
Yes.
Okay. So,
Please proceed.
allow me to read the position paper of the Department of Health, Center for the Health Development CAR, on House Bill 8782, authored by Representative Mark Go. Department of Health, Center for Health Development, Cordillera Administrative Region, supports House Bill 8782, seeking to increase the bed capacity of Davao General Hospital and Medical Center from 800 to 1,500 beds and appropriating funds thereof, offered by Honorable Representative Mark Bo. Davao General Hospital and Medical Center is an 800 bed capacity level 3 VOH retained hospital located in Baguio City. It is currently the main and referral hospital for the whole Cordillera Administrative Region, but it also caters to patients coming from nearby provinces of Region 1 and 2. It is the only level 3 government hospital in Cordillera region. As a level 3 hospital, it also functions as the major hub for specialty training for medical doctors and as a center for medical research. Under the Universal Healthcare Act, VGHMC is being envisioned to be the apex hospital not only for the region but for North Luzon. And the expected increase in the number of patient referrals and admissions for advanced and specialized medical care. Furthermore, VGH is currently the only COVID-19 referral hospital in the Cordillera, and the pandemic clearly emphasized the urgent need for VGH to increase its bed capacity. It is our firm belief that this move is a necessary step towards the realization of universal health care in the Cordillera Administrative Region. This office, therefore, poses no objection to the very timely initiative of the Honorable Congressman Mark Go. Respectfully submitted. Thank you.
Thank you, Dr. Ruby. Comment from DOH? From DBM.
Yes, sir. We just would like to reiterate our previous comments on the other local bills with regards to the implementation of the Supreme Court ruling on Mandana's case, sir.
Congressman Mark?
Mr. Chair, you know, you cannot apply this Mandana's ruling dito sa Baguio General Hospital because this is a DOH hospital, a national hospital. For basically, it's not only for Baguio, for Cordillera, but for the entire northern Luzon. That's why this is very important, I believe that we will all be reactionary if we just wait when this hospital will be doubling its capacity, I mean, in terms of patients. I think this is the right time to plan for it by addressing current problems and issues, and at the same time looking long term, and at the same time making it the center for all the different specialty services, not only for CAR but for regions 1 and 2, as stated by Dr. Dr. Ruñez and Dr. Constantino.
DBM.
Sir, we take note of the comments or the position of Congressman Go.
Thank you. Any other comment? From members?
Can we
now have a motion?
Yes. Kong Akop.
Vice
Yeah.
Chair Sean.
Being from Baguio City and having had the chance to work at the Baguio General Hospital before, I move for the approval of House Bill 8782, an act increasing the bed capacity of the Baguio General Hospital and Medical Center from 800 to 1,500 beds and appropriating funds therefore. So move, Mr. Chair.
Any second? There's a motion to approve House Bill number 8782 and duly seconded. Hearing no objection, the motion is approved. Congratulations, Kong Mark.
Thank you very much. Thank you very much. We have to congratulate the whole country for having BGH here in Northern Luzon. Thank you, Dr. Ruñez and Dr. Constantino, and of course our DBM, as well as I'm sure Dr. or Secretary Duque will support this particular bill. And so there's so many. We have how many USECs from Baguio? USEC David, USEC sino pa?
Jose Kabutahe.
USEC Kabutahe. We have, you know. So thank you, Mr. Chair, for approving our bill.
Thank you, Kong Mark. Are there other matters? We'd like to thank members of this committee and distinguished resource person for today's meeting. Do I hear a motion? Your favorite motion?
Motion to adjourn, Mr. Chair.
Si Kong Rufus would like also to be a part of our Baguio General Hospital.
Yes, I would like to be those present to be co-author of the Baguio Hospital, our premier summer destination.
Kong Mark. Kong
Yes.
Mark, I
Maraming
would want
salamat.
to be author.
Yes, we will be happy to have all those members present be co-author of this House Bill 8782. Thank you.
Thank you, Chairman Mark. I second the motion to adjourn, Mr. Chairman. Thank you very much, Chairman Binato. Thank you.
Hello, Congressman Frasco has just called up. I think he's going to make trouble with this bill.
Hello, Chairman,
Yes, Congressman
good
Frasco.
good morning,
You're
Chairman.
now recognized.
First of all, I'd like to apologize for logging in quite late. I just arrived here in Manila. My flight this morning from Cebu
Yeah, probably you need
was
to.
at 9 a.m. committee.
So, Mr. Chair, we'll continue deliberating on House Bills 8274 and 8275, sponsored by Congressman Juke Frasco.
Yes, Congressman Mark. I think, Congressman Frasco, please proceed. Congressman Duke. Congressman
Yes.
Frasco. I think we have some technical
Yes,
problems.
Mr. Chairman. I have the honor of sponsoring my two local bills, 8274 and House Bill 8275. Mr. Chair, honor
Yes,
of
please proceed.
sponsoring my two local chair. I can hear you. Can
Yeah, please proceed.
House Bill 8274 and House Bill 8275. I had the previous discussion already with our regional director of the DOH, RD Bernada.
I think we have a technical problem. Comsec?
Who has confirmed to me that he has given his favorable endorsement to the local bills. It's quite important for these two local bills upgrading of our existing district. Currently, my district, we have. Can you hear me, Mr. Chair? Can you hear me, sir?
Yes, there's some technical problem, but we can still hear you. Please proceed.
Okay. Yes. So, as I was saying, Mr. Chair, I have received favorable endorsement from our regional director of the DOH, Dr. Bernadas. And these two bills are very important for my district. One is to upgrade the current district hospital. Currently, the district hospital serves over 380 residents of the 5th District of Cebu, including also the neighboring districts of the 5th District. And the other one is the establishment of a children's hospital in the municipality of Liloan in Cebu, Mr. Chair.
Okay.
I'm open to answer any questions. My apologies again for just logging in now. I just recently arrived here in Manila from a flight from Cebu, which was the same time as the committee meeting. Can you hear me, Mr. Chair?
Yes. Yes, Congressman Duke.
Yes.
Thank you very much. I know the DBM and DOS has already presented their position, but for the sake of Congressman Duke, may we listen to the position of DOH? Sir Glenn, Mr. Glenn? Are you still around? DOH? ComSec?
There is a message, Mr. Chair, on our chat group from the DOH.
Okay. From DBM? Ma'am Jane?
Sir, good morning, sir, again.
Yes.
Your Honor, we would like to, while we do find the bill notable, we would like to emphasize po, sir, the implementation of the Supreme Court ruling on the mandanas, wherein there will be an increase in the era of the LGUs by around 234 billion, and there would be a corresponding reduction in the budgets of the national government agencies in the likes of the Department of Health. That's all, sir.
Thank you, Ma'am Jane. A reaction, Congressman Duke?
Yes, thank you, Mr. Chair, and thank you to our representative from the DBM. With respect to the Mandanas ruling and the increase in the local era of the LGUs in the province of Cebu, the district hospital in Davao actually is managed by the province of Cebu, whereas the new establishment of the new children's hospital in the municipality of Liloan has also been given a favorable endorsement from the mayor of the municipality of Liloan, and the upgrading of the district hospital in Davao City, which is under the province of Cebu. The Governor Gwen Garcia, is also favorable with respect to this. So I think, Mr. Chair, we'll get support most definitely from the local government units, the province of Cebu, and also from the municipality of Liloan. And if I may add, Mr. Chair, the mayor of the municipality of Liloan is my wife. So we'll definitely get support from her. And also the governor of the province of Cebu is my mother-in-law. So we will also get support from her, Mr. Chair.
Thank you, Congressman Duke. I believe you.
Thank you, Mr. Chair.
Comment from DOH. Is Sir Glenn still around? ComSec?
Sir, sir, they are still trying to reconnect. Hintay lang po tayong kaunti. Ay.
Okay. Any other comments from any representative from the DOH Region 7? Or maybe we can ask the DOH to submit their position paper to the committee.
Good morning po. This is Julius Castillo, the DOH LLD. I would like to apologize po for the technical difficulty. Our resource persons po are attempting to reconnect po to this hearing. I would like to inform po the committee na we will submit our position paper after this hearing na lang po. Kapag hindi pa po sila makakonect, they're having difficulties po.
Okay, noted. Any other comments from members?
Mr. Chair, are we going to approve this House Bill 8274 and 8275?
If there's a motion,
If that is the situation, I so move that the House Bill 8274 and 8275 be approved on this August body. Thank you, Mr. Chair.
I second the motion, Mr. Chairman. I would like to state that the fact that the Mandanas ruling will take effect next year should not stop committees such as this to be able to approve measures that have been studied for, had been pushed by our members of Congress. And we thank the initiative, the great initiative of Congressman Duke, that in spite of the fact that he had a strip and it was delayed, he's able to come to attend this meeting by Zoom. So that's a great initiative from a hardworking congressman, and he should be rewarded by the approval by this committee of the two measures that he has filed. So I would second the motion of my good friend, Representative Moy Ebkas, to approve the two bills of Congressman Representative Duke Frasco. So move, Mr. Chairman, with Adrian, Congressman Ebkas.
Thank you, my uncle. D.S. Rodriguez.
There's a motion to approve House Bills 8274 and 8275 and duly seconded. Hearing no objection, the motion is approved. Congratulations, Congressman Duke.
Thank you, Mr. Chair. Mr. Chair, I cannot turn on my video, but I just would like to thank you, Mr. Chair, and Congressman Ebkas, and of course my idol, DS Rufus, for your support on my local bills. Daghang salamat kaninyong tanan. Daghang salamat, Mr. Chair.
Walay sapayan.
Walay sapayan, Dok.
Thank you. Thank you. Thank you, boss.
On that, we now adjourn for the second time.
Thank you, Mr. Chairman.
Thank you very much.
Thanks to all our colleagues and our resource person. Thank you.
Maraming salamat, guests, resource persons, and colleagues. Thank you very much.
Thank you.
Congrats, Akong John, ha? Magandang pag-preside. Very order.
I concur.
Thank you sa
Chairman
pagtulong.
Thank you, Chairman Mark. Thank you.